Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
So what do you know about the trachea? Trachea is the windpipe, correct, no? In front of the trachea, esophagus is there, correct, no? So, sorry, not in front of the trachea, behind the trachea, esophagus, that is the food pipe. And this is the windpipe. So, this is fibrocartilaginous in nature and it is a non-collapsible tube. So, it creates the beginning of the lower respiratory tract. Actually, lower respiratory tract can be divided into two, upper respiratory tract and the lower respiratory tract. So, this creates the starting of the lower respiratory tract, correct, no? So the upper respiratory tract, it starts from our nose. From the nasal cavity, it starts, okay? And the trachea, which is made up of a cartilage. So if you are feeling in the cadaver itself, you will get to know which is esophagus, which is trachea. How come you are easily identifying this trachea? Because of the thickness of the walls of the trachea. What is the thickness actually? It is by the C-shaped hyaline cartilage. Okay, then 16 to 20 number C-shaped cartilages are there, which is surrounding the trachea. And always the lumens, it will be patterned. It keep its lumen pattern. And which is made up of a smooth muscle that is known as trachealis. Okay, it's a band of smooth muscle which is made up of trachea, that is the trachealis. And there is a ligament that is also fibroelastic in texture, which bridges the gap between the C-shaped cartilage. So why we have to bridge with the help of ligament between the two cartilage? Because it will allow the expansion of the esophagus during the time of eating. I mean the balls of the food, the passage of the balls of the food. I'll show the picture of cartilage. See here. Here you can see this is the posterior part actually, posterior wall of the trachea. So the anterior surface, you can see the anterior wall which is made up of C-shaped 16 to 20 hyaline cartilage. Did you see the cartilage here? Then inside is the mucosa of the trachea. So I'll show the histology once again. See the epithelium which is made up of pseudo-stratified columnar epithelium. Pseudo means the false appearance. Why that epithelium is feeling false appearance? It's giving false appearance because the arrangement of the nucleus and the cell, it will give a multi-layered epithelium. But actually, if you are watching closely, you will get to know this is a single layered epithelium. Okay, because of the arrangement of the cells and the nucleus at a different level, we feel it is a multi-layered epithelium. So anyway, the the trachea epithelium is pseudo-stratified ciliated columnar epithelium. So this is the histology picture and this is the anatomy. Gross anatomy. If you are cutting the trachea, the cross section of the trachea means here you can see the epithelium. This is the lumen. You are able to see?
Yes, ma'am.
Okay. So this is the histologically, this is the pseudo-stratified columnar epithelium. Just below that, you can see there are submucosa. So inside the submucosa, there are seromucous glands from where the secretions comes. Okay. Below the seromucous glands in the submucosa, here you can see the hyaline cartilage. So here you can see the hyaline cartilage. Did you see the hyaline cartilage?
Yes, ma'am.
These are the chondrocytes actually. So the group of chondrocytes in the hyaline cartilage we call cell nest. So example, this is one cell nest. Did you see the cell nest? Number one group. Yeah. So these are the cell nest. So this is the histology of the trachea. It's very important. And trachea, bronchi, bronchioles together forming a tracheobronchial tree. Okay. So this what is tracheobronchial tree? It is the system of airways which will allow the air into lungs, where the gaseous exchange occurs. So these airways are located in the neck and thorax. And the arrangement of cartilage and elastic tissue in the thoracic wall, it will prevent its kinking and obstruction during the time of head and neck movement. Clear?
Yes, ma'am.
So next about the anatomical position of the trachea. So as you know, the trachea marks the beginning of the tracheobronchial tree. It arises from the lower border of the cricoid cartilage. Where is the cricoid cartilage? In the neck. Okay, so this is like a trachea is like a continuation of the larynx. So this will travel near to inferior mediastinum and bifurcating at the level of sternal angle, and it descends the trachea, which is located anterior to the esophagus, and it will incline slightly to the right. So this is the anatomical position of the trachea. Is it clear?
Yes, ma'am.
Okay, so next about the extent. So trachea stretches from the cricoid cartilage at the level of C6 vertebra. That may be a viva question. C6 vertebra to lower border of T4 vertebra in supine position. So where it ends by dividing into left and right main bronchi. Okay, see the bifurcation. Right bronchus, left bronchus. In between you can see a division, that is the carina of trachea. All right.
Yes, ma'am.
Next about the measurements. So upper half of the trachea you can see in the neck region. That means in the cervical part. Lower half located in the superior mediastinum. Okay. So trachea is almost 10 to 11 centimeter long tube. So the diameter of the trachea is 2 centimeter in the case of men. In the case of female, it is 1.5 centimeter. So 0.5 centimeter difference will be there between the male and female. Okay. The lumen will be smaller in living human than the cadavers. Okay. The next about the location. Upper half of the trachea lies in the cervical part, lower half in the superior mediastinum. So throughout its whole course, it is directly in front of the esophagus. That means the back of the trachea. Okay.
Okay,
So
ma'am.
the left recurrent laryngeal nerve, which lies in the groove between it and the left border of the esophagus. Okay, Nirisha.
Yes, ma'am.
Okay. The next about the structure, we already studied like it is made up of 16 to 20 C-shaped rings of hyaline cartilage and located one above the other, and posteriorly there is no cartilage and there is a gap by the connective tissue, and it is made up of an involuntary muscle that is known as trachealis, and the absence of the cartilage on the posterior wall will allow the expansion of the esophagus during deglution and all.